Hello, I am presenting a slideshow and information to our 24-year-old heroin abuser about infectious diseases. Germs or infectious diseases were first discovered in the 11th century. Back then, they didn't have any antibiotics, so quarantine and isolation was the only way to prevent everyone else from being sick. The diseases that I'm going to talk about today are listed here: chlamydia, gonorrhea, syphilis, genital herpes, Epstein-Barr virus, herpes zoster, warts, HIV, salmonellosis, shigellosis, Lyme disease, and Rocky Mountain spotted fever. Chlamydia. This is a wonderful picture of chlamydia that I'm sure we all would love to have. Chlamydia is the number one sexually transmitted disease in people, male and female, under the age of 25. It takes 1 to 3 weeks for symptoms to show up. Men can be asymptomatic, but most times they have symptoms of a penile discharge, unable to urinate, and urinate frequently. Chlamydia in women are most times asymptomatic. They can pass on disease without even knowing that they have it. Symptoms include, if they are present, mucus discharge and easily induced vaginal bleeding. It can lead to PID and infertility. Treatment would be oral medication such as azithromycin, and with the instructions of not having sex for 7 days. Gonorrhea. Lovely pictures there. Gonorrhea symptoms occur in 2 to 8 days. They can occur in the rectum, throat, and eyes. I am not really sure why they occur in the eyes. I don't know of anyone having sex in their eyeball sockets. But it can be passed on to newborns from the mother's vaginal canal. Men will have a penile discharge, urethritis, sometimes unable to urinate. In the rectum, they'll have a painful rectal discharge. Women may not have symptoms, but symptoms can be present: vaginal discharge, genital itching, and unable to urinate. If left untreated in women, it can lead to PID and infertility. The treatment for both is antibiotics by mouth or injection, and they're instructed not to have sex for 7 to 10 days. Anyone that you have had sex with within the last 60 days should also be tested or treated. Syphilis. The symptoms for syphilis show up in 10 to 90 days after exposure. Ulcers or chancre sores are found in the mouth, throat, genitals, and anus. A rash on the hands and bottom of the feet also can occur. Treatment is a shot of penicillin, and if the patient has had the disease for less than 1 year. If they've had the disease for more than 1 year, then IV penicillin is required. Genital herpes. This is the gift that keeps on giving. Genital herpes has many names, such as HSV1, herpes zoster. The symptoms can occur within 2 to 20 days after exposure. Some of the symptoms are fever, headache, general body aches, and joint pain. No cure has been found for herpes, but it can be managed with acyclovir. Epstein-Barr virus, EBV, is the most common herpes virus. 95% of adults between the age of 35 and 40 have been infected with this virus. Transmission is through saliva. Just good old tongue kissing can give you herpes simplex virus, EBV. It can be inactive for many years. No cure is available and can contribute to nose and mouth cancer. Shingles, caused by the same virus that causes chickenpox, can be inactive for many years, and most times it occurs in patients that live in filth or that are immunocompromised. Now, I have seen patients that have had shingles that I don't believe are living in filth. And it is thought that because they have chickenpox that they will get shingles later on in life. I don't know, something to ponder or look up. Some symptoms are a rash with white pustules, and the fluid from the pustules are infectious, which is why when they're in the hospital, they are in contact isolation. No cure for shingles is available, but management is the same to that as genital herpes. Good old HPV, another virus that does not have a cure, another gift to keep on giving. It's caused by a virus, and there are at least 100 different types of HPV. Symptoms are a flat cauliflower-looking lesion that can appear on the vulva, penis, anus, vagina, cervix, and urethra. If left untreated, it will grow and may prevent sexual intercourse, urination, and defecation. It is also known to lead to cancer. I couldn't imagine having warts so big on my vagina and not being able to urinate, defecate, or have sex. No cure is available for warts, but a vaccine is available for adolescents to reduce the possibility of becoming infected. They can be frozen off with liquid nitrogen, burned off with acid, or surgically removed. This young man who said that he had HIV/AIDS, now there are reports of him being cured of AIDS. I don't know. Maybe money gives you the ability to afford the medicines to cure AIDS. Not sure. But it was first recognized in 1981 in the United States and was thought to only be diagnosed in homosexual men. In 1986, a second type of HIV was discovered in Africa. There is no set time limit for symptoms to show up for HIV, but the antibodies will show up in lab tests within 2 to 8 weeks after exposure. It presents with an array of symptoms: headache, weight loss, nausea, vomiting, body aches, pneumonia, night sweats, rashes. There is no cure for HIV except for Magic Johnson, and there are a number of drugs to manage the disease depending on what stage you are. Salmonellosis. There are more than 200 types of salmonella. Symptoms include gastroenteritis in humans, dehydration, bacteremia, sepsis, and death. It's transmitted by eating contaminated feces particles in foods such as birds, chickens, cows, pigs, turtles, lizards, snakes, and others. Also consuming contaminated foods such as beef, poultry, milk, eggs, vegetables, and other foods. Treatment for salmonellosis is IV fluids and antibiotics such as ampicillin. It can be prevented through proper hand washing when preparing meals. After a bowel movement, I hope that everyone is washing their hands after any movement in the bathroom, and or contact with pet feces. Avoid eating undercooked eggs, poultry, or meat. Shigellosis. Shigellosis is known to cause dysentery. Dysentery is a clinical syndrome that consists of fever, abdominal cramps, diarrhea mixed with blood and mucus. Transmission is person to person by anal contact or mouth root. I'm not sure if they mean if the mouth is supposed to be on the anal or on the anus, or just regular old person-to-person contact. It can occur in contaminated water or by consuming contaminated food. Symptoms occur within 1 to 4 days. Treatment is hydration, antibiotics, and rest. Lyme disease. Lyme disease was first recognized in 1976 and caused by black leg ticks. Symptoms occur from 3 to 32 days in 70 to 80% of people that are infected. Can include rash, bullseye lesion, headache, fever, chills, and can affect the nervous system and cardiac system. Treatment depends on this stage of infection, but usually antibiotics for 2 to 3 weeks. Rocky Mountain spotted fever. discovered in the Rocky Mountain area in the U.S., caused by the American dog tick and the Rocky Mountain wood tick. If left untreated, the patient may die from the complications 8 to 15 days after the onset of symptoms. Symptoms include fever, nausea, vomiting, body aches, anorexia, and headaches. Antibiotics also is a treatment. Have a little quote here. If you have an erection and don't want an infection, you better use protection on your genital section. Thanks for listening. Hope you enjoyed.